Ladies and gentlemen, we are still waiting for Minister Budi to arrive, and we will start soon. Okay.
Sorry, I'm late.
Ladies and gentlemen. Good morning, ladies and gentlemen, distinguished guests and member of the press. Thank you for all of you for joining us today at this press conference as part of the high-level meeting on tuberculosis innovation. And to lead this press briefing, I'm honored to introduce our moderator, Sharifah Liza Munira, PhD, Director General Health Policy Agency, Ministry of Health, Indonesia. She will guide our session, introduce our distinguished speakers, and facilitate an engaging discussion on TB innovation and Indonesia's role in driving global TB elimination efforts. Without further ado, please join me in welcoming Sharifah Liza Munira, PhD, and I will hand over to you, Dr. Sharifah, to lead the session.
Thank you, Ibu Fina. Good morning and welcome, everyone. I'll be moderating today's press briefing for the next 60 minutes. Our aim in this session is to shift the narrative on TB, emphasizing that eradication is achievable due to the innovation around TB. We have with us 5 especially esteemed speakers who will share key insights into the urgency of TB elimination, the innovative solutions being developed, and the leadership required to drive forward the global TB agenda. I'd like to introduce our esteemed speakers. First is His Excellency Budi Gunadi Sadikin, Minister of Health of Indonesia, who will be sharing Indonesia's progress and commitment to TB prevention, diagnosis, and treatment. Second is Dr. Ifedayo Adetifa, Chief Transformation Officer and CEO of FIND, who will be focusing on the development of accessible TB diagnostic tools for high-burden settings. Then we have Ms. Cassandra Kelly Cirino, Executive Director of the Union, who will be speaking on the importance of collaboration across sectors to ensure TB innovations are effectively implemented. Then, Dr. Mel Spiegelman, President and CEO of TB Alliance, who will share how they're leading efforts to develop shorter, safer, and more effective TB treatment regimens. And of course, last but not least, Dr. Gagandip Kang, Director at the Bill and Melinda Gates Foundation, who will share on the foundation's work on advanced diagnostics and genomic solutions. So let's now move to our moderated discussion. To keep our discussion on track, I'll be directing one question to each speaker with a maximum of 4 minutes per response given our limited time. I hope you don't mind. Our first question is for His Excellency Budi Gunadi Sadikin. Minister Budi, Indonesia has recently prioritized TB elimination as a national focus. Could you share how this prioritization has shaped national strategies in prevention, diagnosis, and treatment? And additionally, what key successes do you hope will inspire other high-burden countries? Over to you, Minister Budi.
First, my target to the team next year, we have to reach 1 million more notifications. Ya. Jadi ada 1 juta orang yang harus kita lihat dari 1 juta 60, 1 million 60,000. I want to reach 1 million diagnosed. And to do that, we need massive revamp of our existing surveillance system. So new technology is this required, because to get 1 million, we have to do screening to about 7 million to 8 million-ish populations. And then to do that, we need a massive deployment of our screening capability, but also reduce the cost. So that's why I'm very keen to find a way that we can do screening or testing below $2 per testing. Now it's about $8 to $10 per testing. So we need to reduce the cost. That is on the screening side. And then on the therapeutic side, I'm happy with the new regime, the BPAL and BPAL-M that we introduced last year nationally. But I'm still waiting for the new regime for the sensitive TB. My expectations, we can reduce the therapeutics or the regime less than 3 months or even less than 2 months, because that will increase our success rate. On the vaccine side, the last push, Indonesia is supporting the clinical trial level 3 for M72 vaccine, but vaccine is very tricky business. Success rate is very, very low, so we need to put our egg in several baskets. So I asked Ibu Rizka, because we have extra funding, we would like to see 2 or 3 more tuberculosis vaccine that we are participating in the clinical trial. And for the funding side, government has agreed to put next year additional 500 million US dollars, so on top of our 250 million. So we have more money, capacity, but we need to make sure that we deploy the resources properly. That is from my side.
Thank you, Minister Budi, for your insights on Indonesia's target and approach. Now moving on to our next speaker, Ms. Cassandra, as Executive Director of the Union, you bring a wealth of knowledge on collaboration efforts in TB elimination. From your perspective, how crucial is cross-sector collaboration in achieving our TB goals, and what new partnerships do you believe are needed to accelerate innovation?
Thank you, and I think Minister Budi, you said quite a few very important pieces about cross-sector collaboration and the need for different sectors to really come together and work very closely. Innovation without accessibility, as was said earlier, is not going to be a success. And the only way to ensure accessibility is to work with our global partners and our on-the-ground partners, specifically with communities and affected populations, so that we understand how best to implement the innovations that are coming out. How do countries uptake these rapidly? How do we evaluate them? And how do we ensure that they're sustainably accessible with the financial systems and models that we have in place? And this takes concerted effort across all of our groups and a lot of advocacy. So everything from research into implementation science to advocacy in our community groups, working together with our policy makers, our governments, our ministries of health, and our parliamentarians is critical to ensure that we actually have uptake and the actual rollout of the new technologies and innovations that are coming out.
Thank you, Ms. Cassandra, for underscoring the importance of partnership in this fight against TB. Now let's next hear from Dr. Ifedayo Adetifa. Dr. Adetifa, FIND has played a central role in developing affordable TB diagnostic tools. Can you share specific examples of how these tools have impacted TB detection in low and middle income countries?
Thank you very much. Well, FIND was set up with a mission to achieve diagnostics or diagnosis for all in sort of the more resource-constrained parts of the world, which, of course, overlap perfectly with many of the high-burden TB countries. And we do that through a few ways. So in terms of diagnostics, which I am glad, this is not things where we have to remind people about the importance of that. To achieve all that we've set out for, the goals we've set out for TB globally and even in Indonesia, we need to correctly identify people for treatment, screen and make diagnosis. And FIND has been at the forefront of bringing about innovation in the diagnostic space to ensure that we have safer, cheaper, and more available products in the community. One notable area of achievement is from 2010, and I'm not sure how many people remember that FIND was instrumental to the development of the Gene Expert, which is a near point-of-care nucleic amplification test, of which there are now several iterations, of course, and beyond TB, we can see obviously how this platform has benefited the diagnosis and care for other conditions. Speaking about screening, we have also historically and currently doing work on computer-aided diagnosis for chest x-rays, because while we try to scale up x-rays and the digitization of x-ray technology makes it easier to do x-rays in the most remote parts of the world, including places that are only accessible by motorcycles. But the key thing is now the interpretation of the image, for which there are fewer expert eyes available. And what the work we are doing is to use computer-aided diagnosis and application of AI tools to the interpretation of x-rays that will, of course, increase the number of people correctly identified with TB, and, of course, ensure that they are connected to care as well.
Thank you for highlighting the practical impacts of these diagnostic advancements. Now moving on to Dr. Mel Spiegelman. Dr. Spiegelman, TB Alliance has championed the one-by-one approach in TB treatment regimens. Could you elaborate on this vision and explain why it has the potential to be a game changer in TB treatment?
Sure. Thank you. I think with the building off of the success that we've had with reducing the treatment of highly drug-resistant TB from 24 months to 6 months, and at the same time increasing the cure rate from 25% to over 90%. We've been able to develop even more powerful drugs and actually couple them with more powerful technologies. So our goal, and you'll hear about this more in the afternoon, is what we're calling our one-by-one initiative. And if you heard Professor Marx's discussion above, or this morning, we need to break the cycle of both transmission, and we need to be able to effectuate cure in a much more aggressive way, as Minister Budi has so well described. 4 months is way too long for active TB. So our goal, number one, there are 2 billion people in the world who are infected with TB. This is the reservoir. It's not mosquitoes, it's not other animals, it is people who infect other people. We need to break that cycle. That cycle now, through implementing much more potent drugs and new technologies like a vaccine with a single injection, will be able to be done, we expect, with appropriate funding and resources in 1 day. Similarly, with the coupling of new drugs, much more potent drugs, coupled with new technology also with long-acting injections, we are very comfortable with a goal of 1 month, not 4 months, not 3 months, not even 2 months. 1 month of total treatment for patients with the 10 million with active TB. As Professor Marx described, if you break those cycles, then we have a realistic path towards truly ending TB. And not just picking a date sometime in the future that's frankly pulled out of the air, but actually putting together a true pathway, true roadmap with commitments, solid commitments from all the players on a global basis that will make that date happen. Thank you.
Thank you, Dr. Spiegelman, for sharing this promising targeted approach in treatment. 1 month would be fascinating indeed. Thank you. Finally, we'll turn to Dr. Gagandip Kang. Dr. Kang, the Bill and Melinda Gates Foundation has advanced the use of genomics and diagnostics to understand TB transmission patterns. How does this approach help in pinpointing hotspots and directing resources effectively?
So it's wonderful to be able to follow all the other speakers because now I know what not to address. So if you think about TB, the beautiful articulation of prevalence and incident TB and of the reservoir, this is where diagnostics of symptomatic individuals and screening of asymptomatic individuals becomes absolutely critical. So the work that we've been doing on diagnostics approaches has been, as Minister Budi said, to make sure, one, that we lower the cost of treatment, but second, we want to break monopolies. We want to make sure that countries have choices and that those choices can be, as far as possible, locally sourced. So you are not dependent on a global market to access the tools that you need for diagnostics. Innovation, we know now, can come from every part of the world. How do we make sure that innovative diagnostic companies that are located in the regions where the problems are able to make the right kinds of tests at the right prices with the highest possible quality? So that's around looking at diagnosing symptomatic patients. Then comes screening approaches. And we heard today that there are many ways of doing screening that can include radiology as well as molecular-based testing. Now, this is a complicated problem to address, identifying the right populations, developing the right tools, and this is where the foundation and partners do the work. But ultimately, it is about evaluating these solutions in places where problems are. So it's absolutely fabulous that Indonesia is doing more and more clinical research in Indonesia. What we'd like to be able to do is to partner to make sure that we deliver for you as quickly as possible the solutions that you need. Because ultimately, you can have evaluations done in any part of the world, but the implementation has to be done in the country. So partnering early so that we implement as quickly as possible, I think, is critical. Now, this is using radiology, this is using the tests that we develop, but it's also using genomics. Understanding what transmission patterns looks like, being able to track chains of transmission requires genomics capacity. Being able to identify cases of resistance also requires our ability to be able to sequence. And you have here in Indonesia the scientists that have already started to do that. We look forward to working with them to make sure that you have a wraparound package for everything that you need to be able to address TB.
Thank you, Dr. Kang, for unpacking the importance of innovation and collaboration in the fight against TB. And thank you also to each of our speakers for these valuable insight, which give us a comprehensive look at the tools and collaborations essential to advancing TB eradication. Now, we'd like to open the floor for questions from our media colleagues. As this is a hybrid session, we'll be taking questions from both our in-person journalists and those joining us virtually via Zoom. For our online participants, feel free to type your questions in the Zoom chat and we'll address as many as time permits. And to start, I'd like to invite questions from our in-person media attendees. Please introduce yourself and your organization, and if possible, direct your question to a specific speaker. Silakan, Pak.
Terima kasih. Selamat pagi, Pak Menteri dan para tamu undangan. Izin bertanya, Bapak, apa saja inovasi atau terobosan yang selama ini dilakukan oleh Kemenkes beserta jajaran terkait pengobatan tuberkulosis khususnya di daerah terpencil atau yang biasa disebut dengan daerah 3T, tertinggal, terdepan, dan terluar yang selama ini sulit mendapatkan layanan akses kesehatan secara maksimal. Terima kasih, Pak Menteri.
Sorry, I have to answer in Indonesian. My apologies. He is asking me what are the innovation that we have done. Jadi yang pertama memang ada beberapa kelompok kerjaan lah Yang pertama kita harus screening dulu, sama kayak COVID. Orangnya positif apa enggak? Kita mesti tahu kan ini penyakit menular. Kalau positif kita obatin. Nah untuk screeningnya ini yang sudah kita lakukan dulu adalah kita punya mesin yang namanya TCM, tes cepat molekular, yang dipasang di seluruh puskesmas. Tapi ini nggak cukup. Kita mau memanfaatkan mesin PCR yang dulu kita pakai buat COVID. Jadi PCR ini adalah alat yang bisa mendeteksi segala macam jenis penyakit menular. Kayak COVID itu virus. Kalau TBC ini bakteri. Malaria itu parasit. Kita juga bisa pakai untuk tes cervix cancer. Cervix cancer itu virus. Jadi kita mau memanfaatkan existing PCR yang ada di 100 of cities yang kita punya dengan mendevelop a specific reagent yang bisa deteksi whether is yes or no tuberculosis, and then after that if possible use the same reagent or a different reagent to test apakah dia resistant atau non resistant. Jadi itu inovasi yang sudah kita lakukan, dan PCR ini mesinnya kan ada di mana-mana, teman-teman udah tahu kan, termasuk juga di daerah tertinggal. Nah selain tes PCR kita juga gunakan X-ray, karena gold standardnya itu selain tesnya dengan molecular biology testing, NAAT gitu ya, nucleic acid amplification test technology, juga bisa pakai X-ray untuk diagnosis. Kita beli 35, starting with 35 mobile X-ray. Itu ada perusahaan di Jepang, Fuji, develop X-ray yang portable, yang bisa dibawa kemana-mana. So for difficult locations kita deploy mobile X-ray ini, dan we do pilot project testing. Kalau is proved to be effective, then we will deploy many more devices untuk kejar until the last mile untuk do testing. Itu dari screening and testingnya. My challenge, saya mau reduce the cost. Kalau bisa di bawah $2 per testing. Because kita harus tes kan banyak ya, 7 to 8 million people. Itu innovation di testing. Nah di pengobatan yang sudah Indonesia lakukan, last year kita launch tuh BIPAL sama BIPAL M, it's a new drug regime. Yang tadi untuk TB resistant, yang tadinya 22 bulan dia mesti minum, sekarang di reduce 6 months. Ya. Nah it's done already last year. Yang saya mau, my plan is kalau bisa untuk yang TB sensitive, ya most our people itu kenanya TB sensitive, itu the regime is still too long. Itu ada 6 months, and the pills I think 5 or 6 pills. So this is good news for me that he mentioned 1 injection, which is I love, or even 1 month of regime. But I'm looking forward, if possible, we launch it yesterday, gitu kan? Or, as quickly as possible. I asked Ibu Rizka, let's work with them untuk jadi clinical trialnya Indonesia, because we have so many patients gitu kan. Let's Indonesia be actively involved in the clinical trial, bukan hanya only the vaccine, but tapi juga on the therapeutic side. Karena 1 injections or 1 month treatment is a very good news for us, a very good news for us to break the barrier. Dan another invention adalah vaksin, karena every COVID-19, how do we stop COVID-19, break the cycle? Karena ada vaksinnya. Why we can put smallpox to the end? Because karena ada vaksin. So in a way, combination vaccine therapeutics itu is a game changer kalau kita bisa lakukan itu. Jadi vaksinnya kita sekarang participating in the Gates Foundation's M72 clinical trial, tapi vaksin ini is very tricky business. Ya success rate-nya very low gitu. Dari 6 mungkin berhasil 1 success rate-nya. Itu sebabnya aku ask Ibu Rizka, so let's Indonesia participated in clinical trial for several vaccine. Jadi kalau 1 fail, we have another 1 gitu ya. Itu 3 bidang di mana kita do aggressive TB innovation program.
Terima kasih Pak Menteri. Let's take another question from the in-person journalist. Silakan Bu.
Thank you. I'm Nila from IndoBaliNews.com. Maybe my question is, can be answered by all speaker. It's about how do you view the role of telemedicine and mobile health technologies in expanding access to TB care and diagnostic. And second question for Mr. Budi is about the stigma, Pak. How does Indonesia address TB stigma within communities, and what initiatives are being implemented to encourage people to seek testing and treatment early? As we know, Pak Budi, in village maybe TB is always relationship to maybe HIV or poverty and social class in community. Thank you.
Thank you for the question. The role of telehealth in care and diagnostics for TB.
Well, let me not answer that exact question, but one of the things that we've certainly learned in the global rollout of the BPAL regimen, which obviously is associated also with needing to diagnose the patients, we need innovation and really great science, not just in what has traditionally been looked at research and development, but also in terms of how to get drugs, diagnostics, vaccines to patients. And that will certainly include things like mobile health, because clearly it is going to be necessary to take diagnosis, treatment, etc. to the patient, not the patient necessarily come to us or to whomever is actually delivering it in some big building. That will require tremendous innovation, which is possible but not necessarily easy. And mobile health is clearly only one aspect of that. So let me stop there.
Maybe I can just add to that too. I think one of the key things for using new innovations like telehealth and mobile health clinics and chest x-rays, portable chest x-rays, all of this is critical because what it does is it brings the care to the patient, as Dr. Spiegelman was just saying. And that's what's one of the most critical factors that's missing in TB, is that we actually need to close that gap in terms of the number of patients with active TB that are found. We have to bring the care, we have to bring the services to the patients, asking them to travel, asking people to come into the tertiary level facilities has been the way we've been doing it for decades, and we know that's what causes the gap. And so really making sure that the innovations that are coming out, the treatments are simpler, the diagnostics are simpler, they're less expensive, we can actually implement those in the most rural parts of our communities to support the people that are actually living with TB and infecting others with TB is what's going to break that chain and that cycle.
And do you think that the effectiveness is the same as maybe 100%?
The effectiveness of the telehealth and so all of these tools are as effective as if they get used. So if we don't use them and we don't have accessibility to them, it doesn't matter if they're perfect in a laboratory or in a research facility, they're not going to actually have any impact. So when we implement them in the communities, even if they're not 100% effective, they're making a huge impact, because for every patient that we diagnose, every patient that we put on treatment, every patient that we cure, we're actually breaking that chain of cycle, and we're going to start to bring that incidence rate down and that prevalence rate down.
So I'd like to build on what has already been said to address what is a really important gap in TB, which is keeping patients in care. So if you think about telehealth operations, they actually allow you to stay in touch with the patient much better. So if you have a lot of loss to follow up, one of the ways that it can be more easily addressed is if you have solutions that allow you to stay in touch with patients better. And telehealth, as we saw during COVID, is one opportunity to be able to access the healthcare system if you can't necessarily travel to a health facility. The second part, of course, is increasing the volume of data that is available to you. You can use mobile health technologies to make sure that patients can be captured, as well as data continues to flow through the system. These would be two approaches that have not been utilized sufficiently, but would actually allow us to build a better care continuum.
Okay, I'm just going to try and add a bit to that. So, in recognition that it's not just enough to innovate and find sort of new diagnostics and all of that, FIND continues to push to, as part of contributing to closing this gap, diagnostic gap between communities and health facilities, is we are investing in diagnostic tools that allow for community testing and screening. Ultimately, we would like to have tests that people can administer themselves, or that others in the community can administer to correctly identify those that either need further screening or confirmation, or even are correctly identified with TB as well. And one of the approaches by which we are doing that is to invest in innovation for tests that do not depend, for example, on sputum. So if you could take a tongue swab or urine or other less non-sputum samples, that makes testing easier in communities. The other thing to say is that we are working very closely also with the Indonesia Ministry of Health, and we are very much aligned with the health transformation agenda, particularly the pillars for primary care and the bit about health technologies. And sitting across all of that is our digital health program, which again, like has already been said, allows you to retain people, but also more importantly, equips or supports healthcare workers in the most rural parts of countries, including countries like Indonesia, to screen, identify, and retain data on people that need to be connected to care or need to be tracked for treatment as well. And this is another area where sort of the digital health program that we have is quite useful. Of course, this is also linked to things like the telehealth that has been mentioned, the interpretation of chest x-rays, and even the application of digital technologies or other AI-enabled tools to even the interpretation of test results or new tests that may come on stream.
Then stigma. Stigma is one of the biggest in improving our healthcare services to the people. It's not only tuberculosis. HIV in Indonesia is very sensitive issue and very stigmatized. I think mental disorder in Indonesia is also very stigmatizing. And my approach is, I need your help. This is changing people perceptions. And we have huge opportunity in the changing of generations with social media. So don't let only social media is used by politicians, to gather vote. We have to aggressively use social media for healthcare initiatives. So that is what I told my team. Not only politicians, we have to follow the way how politicians use social media, but use it for healthcare initiative, or recruit the politicians, social media specialists, to help us, promoting healthcare services. But this is where I need you all. The Ministry of Health is, I asked them to really do a huge campaign on, it's okay not to be okay. This is a disease. It's not your mistake. Whether you have a mental disorder, you have HIV, you have tuberculosis, our job is to treat them, whoever they are, what religion they are, wherever they are. And it's not their mistake. So it's okay not to be okay, and our job is to treat them. I strongly believe, like COVID-19, why Indonesia is successful, because we don't treat this exclusively. We need to treat them inclusively. It's not something that we can do it alone. We have to do it together. And most importantly, we cannot approach this as a program. We have to create a movement. And then when the movement, Indonesia is social capital is very high. Indonesian people love to help, love to support, love to contribute. So we just have to unlock this massive social capital by establishing a movement. And movement means that a movement that is okay not to be okay. And our job is to treat you. Yeah, and I need your help. And as a media specialist. Yeah.
Thank you, Speaker. It's really about reaching the last mile and also those that are unseen. I'd like to first check in with the organizers if there's any questions from Zoom.
We have one question from Zoom. So the question coming from Ali Burhaini Faisal from the Jakarta Post. She has two questions. So the first question, under the new Prabowo administration, how much money has been allocated by the government to improve health screenings, including to better detect TB? That's the first question. And the second question, what key barriers we meet in developing new figures, including new TB vaccines and genomic diagnostic for TB vaccines? Maybe the second question can be answered from all speakers as well.
What is the second question?
The second question is what key barriers we meet in developing new figures, including new TB vaccines and genomic diagnostic for TB vaccine?
I will answer the first question. The second question, the global expert can do it better than me. But Prabowo has committed, the new president, 500 million on top of the existing 250 million for tuberculosis budget. So specific for TB budget. On top of that, the president also have give me another 250 million to do screening, to invest in new screening methodology. And we are creating a program, hopefully next year we will launch birthday screening. So the government will give you a birthday gift, but doing a screening. So everybody, when you reach your birthday, the government will give you a free screening program. Depends on your age. Like example, babies will have a different screening with children. Children will have different screening with adults. Adults will have a different screening with elderly. So people like me, that 360 this year, unfortunately Indonesia is also very stigmatizing. When you are 60, you are categorized as elderly, and they give you a special treatment and everything. Free this, free that, for life and this one, discount here, discount there. Yeah, it's good, but it's also very stigmatizing for me. So that's why I feel, I know they are telling me that I'm old. So that's why I run Berlin Marathon this year. It's just to prove that I'm not old. I'm old, but I'm still live healthy. But it's good that we do different screening for different group of people as a gift. That's why $250 million are given for us to take care of the cost of this screening. So 500 million for tuberculosis, additionally, and 250 million for screening, including tuberculosis. And then I will pass to the floor on the second questions about genomic sequencing and the new technology on TB diagnostic. Yeah?
I think it was a two-part question on both vaccines and on diagnostics. And for vaccines, I think completely agree that putting all your eggs in one basket is not appropriate, and we still need to be thinking about new vaccines. TB has been a really tough target for vaccines. We have no guarantee that the vaccines that we are developing now will work, and there are always new antigens being brought forward, new platforms being explored that may have a solution for us. So one example of that is while M72 is antigen plus adjuvant, we also have vaccines that are being developed on an mRNA platform for TB. There are always questions, and the ultimate answer comes from testing vaccines in people to see whether they prevent disease or not. And preventing disease is one thing, preventing infection is another, so a long way for us to go. When it comes to diagnostics, we have to first ask the question, what is the diagnostic for? Is the diagnostic to identify people who are infected? Is it for people who are symptomatic and sick? Is it to be able to test for resistance or not? Where we are today with diagnostics is a better situation than we have ever had. I think Dayo referred to Gene Expert being a technology that was developed about 15 years ago. We've learnt a lot in those 15 years, and most of it has been around the approaches to using genomics to develop better diagnostic technologies. We'll continue to innovate in that area.
Can I just add one thing around the barriers, I think, to drugs, vaccines, and diagnostics that we still have to work together in a very collaborative fashion? It's around accessibility through regional manufacturing. We really need to work together to address how these interventions are actually being manufactured, where they're being manufactured, so that we can ensure that they're accessible in the countries that need them most. And I know it's a big topic in Indonesia in particular, and many other countries, to try to address this with not just the manufacturers, the drug manufacturers, the vaccine manufacturers, and the diagnostic manufacturers, but also by really working with local innovation in the countries, in the highest burden countries, so that you're developing tools that are appropriate for the populations that you need to have access to. And I think that's a critical piece to one of the barriers that we need to try to address collectively in order to ensure that all of these new innovations are always accessible.
Yeah, I think if I just add 2 points. If I had to name the single biggest barrier in TB, not just in diagnostics or in vaccines, it's resources. And that's where I really give the government of Indonesia unbelievable credit for what's been done, because there are so few countries these days that are actually increasing the amount of resources that are going to TB. The other major point that I want to highlight is, in addition to what I discussed previously about dramatically shortening the time to treat latent infection and also active TB, is frankly on the patient level doing away with the need for diagnostic testing for resistance, because all of the drugs that we are working on are novel drugs with novel mechanisms of action that therefore have minimal, if any, resistance in the community already. So whereas surveillance work will need to be done on a country, regional, global level, if we can do away with the need to actually test every patient for resistance, which looks very feasible and is part of the plan, that would have also a tremendous impact.
Well, I think everything has been said. I just would like to highlight the challenge with resources. Obviously, if you compare the amount of resources available that has been invested in TB compared to, say, malaria or HIV or some other conditions, then you get a sense of how sort of relatively neglected TB has been, again, compared to other conditions. The second point I'd like to highlight is one, again, in which the Indonesian government is taking exemplary steps that I hope that other countries will follow. Is we need sort of the whole R&D ecosystem or activities within countries, within regions, that is focused on finding solutions to locally prevalent problems needs a kick in the backside, or needs more impetus, because that's the only way that home-grown solutions, innovations, and solutions are driven by locally relevant problems to improve health. And if a lot more of that happens through, for example, more domestic resourcing, request for more technical advice, willingness to participate in partnerships. It's not every country that welcomes phase 1, phase 2 clinical trials, for example. In many places, it will be extremely difficult to even sort of cross the regulatory hurdles, talk less of getting the political commitment to do that. So these are some of the barriers that we need to overcome to close the gaps for diagnostic therapeutics and vaccines. And I hope that we can get more ministers like Minister Budi and the government, like the Indonesian government as well, that is not just willing but also leads the way by committing their own resources to this effort.
Thank you, speakers. I'd like to come back to the room for journalists here. Maybe 2 more questions. I saw a hand raised. Silakan, Ibu.
Hello, my name is Putu Trimulyantari. I'm from Antara Indonesian News Agency. My first question is for Mrs. Cassandra or others maybe. Is there any country that Indonesia can follow as an example in dealing with TB? Because the similar countries with large population like China or India also have high cases like Indonesia. And then the second question is for Mr. Budi Gunadi. Sorry, I use Indonesia for our minister, but and maybe can you answer with bahasa, Mr. Pertanyaannya, tadi kan salah satu solusi akhirnya adalah vaksin. Sampai sejauh ini itu perkembangannya sudah seperti apa, Pak Menteri? Dan apakah ada vaksin untuk orang dewasa juga nantinya? Lalu kemarin Pak Presiden, Pak Prabowo itu kan bertemu Xi Jinping ya Pak ya. Kira-kira apa ada pembahasan terkait kerjasama kesehatan juga mungkin dengan China, Pak? Mungkin itu saja, Pak. Terima kasih.
Would you like to start, Ms. Cassandra?
Sure, thank you for that question. I think there's several countries that have led the way in implementing new innovations into their health systems. And one of the things I think that every country needs to evaluate is what is specific to their health system that will allow innovations to be implemented as quickly as possible. So not every country is the same. I think Indonesia has done an extremely strong job at really identifying innovations and how to bring them closer to the patients at the primary care level. And other countries could learn from that experience and from the 100 days that the government is now championing. And other countries that have had really good success, I think, have really focused on strengthening primary care level introduction, community health workers, and the liaisons between community groups, patient groups, the governments, and then also the health systems. And without that strengthening, usually what happens is there's a lot of gaps and there's a lot of loss to follow up, as Dr. Gandip was saying earlier. And that's where we see a lot of patients, specifically with tuberculosis, where we get reinfection or we get an increased level of infection in the community because they're not accessing care all the way through, they're not completing treatment, they're not actually going into the tertiary care systems for the complete care that they need.
Vaksin. Kita Indonesia sekarang coba questions kan about vaccine and second about Pak Prabowo meeting with Xi Jinping. Vaccine, we are targeting 3 type of vaccine and different vaccine technology. The first one is the M72, which is a vaccine technology-nya tuh recombinant, protein recombinant, which is we can manufacture already in Indonesia. Ya, sekarang clinical trial phase 3 and already recruiting patients, gitu kan, 5 centers. Yang target number 2 is a viral vector-based technology vaccine dari CanSino Biologics in China. Yeah, we are supporting the clinical trial level 1 in the country. Yeah? And this is one of the topic that we are discussing between Prabowo meeting and Xi Jinping. This is the don't put your egg in one basket. I'm a banker for 30 years. You never put your egg in one basket. And different country, different technology. One is protein recombinant, the other one is viral vector technology. The third alternative that we are pursuing, but it's very difficult to convince for this company to join with Indonesia, is mRNA-based vaccine from BioNTech. It's also being mentioned. I met with them twice already, and but the progress is the discussion is slower than our Chinese counterpart. Our Chinese counterpart. But we are aiming to also support the clinical trial phase 1, and mRNA technology can be faster. And actually, Indonesia has developed the mRNA vaccine manufacturing technology. Because now, when I joined, we only have one vaccine company. Now we have 3 vaccine company, will be 4. Gitu kan? Very soon, and one of them are capable to do mRNA vaccine technology. Jadi ada 3 ya, 3 vaccine candidate that we are approaching, different country, BioNTech in Germany, GSK in US, and then CanSino in China, and we also have a different platform, different technology. One is protein recombinant, the other one is viral vector, the other one is mRNA technology. So we are spreading our risk in different type of technology to understand which one will deliver the result first, and we are committing money into it. Talking about the meeting with Xi Jinping, Pak Prabowo is talking about this viral vector vaccine developing agreement with CanSino.
I was reminded about our limited time, so that was our last question. And as we conclude, I'd like to invite each of our speakers to share their closing remarks. Would you like to start, Dr. Kang?
So, there's been a lot said about how there is a resourcing gap in TB. And what we are seeing today is Indonesia really leading the way and what needs to be done in terms of commitment to resources, but also commitment to collaboration and commitment to innovation. So if we had more countries that followed this pathway, we'd all be in a much better place, and it is our collective responsibility to continue to foster this atmosphere of opportunity and optimism at what is a difficult time in most of the rest of the world.
Dr. Spiegelman. Thank you, Dr. Kang.
I want to leave this with a realistic but very positive note, that when I look at all the changes within the TB landscape, diagnostics, therapeutics, preventatives, and also what's happening in country levels, Indonesia, prime example. TB, tuberculosis, is truly a disease that can be eliminated. Not easy, but it is now realistic to truly talk about real elimination of TB, put together the right people, the right places, the right amount of resources, and we can get there.
Thank you, Dr. Kelly. Ms. Kelly Serino.
So first I want to say thank you to the government of Indonesia, Minister Budi, for hosting the Union Conference here in Indonesia. I think it's a testament to the work that you've done and the vision that you have around eradicating TB. And as our colleagues just said, today's the day we can actually get there. And in the next week, I think you're going to see a lot of new innovations and very exciting developments that are going to be announced and discussed, and again, around collaboration and bringing a cross-sector of people together to listen and to learn, and then to really get down to the business of how do we eradicate TB? How do we use the tools that are already in our toolbox, the ones that are emerging in the next year or 2 years? How do we actually drive towards that elimination? We're there, we have the ability to do it. It's not easy, but nothing that's worthwhile is ever easy. If we don't start, we'll never get there, and I think we now have the right momentum behind us, and thank you again for hosting.
Beautifully said, Dr. Adayo.
Well, it's difficult to beat what's been said already, but I think my concluding remark is, across the breadth of areas that are required to bring us closer to eliminating TB, whether it's innovation, access, partnerships, putting community at the forefront of everything. I'm just reminded of a saying that if you want to travel fast, travel by yourself, but if you want to travel far, what we need to achieve TB elimination, then we need more than ever before, especially as approach the last mile, we need partnership. Not just the global entities making plans, but also partnerships with communities, with countries, with authorities, with experts to domesticate all that we aspire to collectively in terms of global TB control.
Thank you, Dr. Aditifa. Pak Menteri.
Vision without action is dream. Action without vision is blind. So we already have a vision that we want to eradicate TB in 2030 by WHO. Let's do concrete actions. Thank you.
Please join me in giving a warm round of applause to all our speakers. Thank you again to all our speakers for your closing remarks and also to the media colleagues for your presence and engagement. Today's session really reinforces the collaborative spirit and innovative drive needed to combat TB on a global scale. And with these advancements in prevention, diagnosis, treatment, and financing, we move closer to a future free of TB. Let's continue to work together, raising awareness and driving the global health agenda forward. Thank you, and please give a warm round of applause again to everyone in the room.
Thank you to our speakers. I would like to invite all of you to stand for the photograph together with the journalists. Maybe you can go in the center. Yes? Yeah, maybe just right here. Okay. We would like to stand for the photograph. Yes, with Buliza as well. Okay, can you look at the camera and give your best smile? 1, 2, 3. Okay, just give a second for the journalists. 1, 2, 3. Do you want to change the freestyle or is there any pose? Stop TV. Okay, so okay, in 1, 2, 3. Okay, just hold a minute. Okay, 1, 2, 3. Okay, thank you so much for all speakers for insightful discussion.
Yeah.